Good morning. How's everybody doing? First talk of the panel, first talk of the summit. So it's always good. My role at Emids is tied to our consulting business and our tech business. And one of the things we do in our consulting practice is we often help leaders take stock. And that, as we start and look forward, it's always good to take stock as a starting step. So the goal of this discussion today with these eminent folks is really to get some direct experience how in each of your scale businesses you've taken a moment to take stock. There's been a ton of technology transformation that's been done to us and by us over the course of the last few years since the pandemic. And what I'd love to get your reflections on, and maybe Katie, you can lead us off with just a little bit of a brief about you, and then maybe you can dive into the question, is looking back over the course of 23 when we've had so much change, a lot of macroeconomic change, a lot of kind of new exogenous forces upon our businesses. Looking back at the technology transformations and the operational transformations your organization has made since post-pandemic, what's working, and what are you taking a second look at?
Yeah, it's a great question, Dinesh. So the first thing I'll say is I am the pop of color that the designer used. Like, I knew this was going to be like all dark blue on the panel, so I went all in.
Between the thorns.
But Katie Hicks, CIO for Insurance for Humana. And as I look back, we were all bogged down in tactical issues when the pandemic started. So all of a sudden you had to figure out, you had engineers that knew how to work remotely, but you had some onshore agents that didn't. And we had to make sure we had continuity of support for our membership. We had to get devices out. We had to deal with bandwidth problems for video calls and things like that. As we moved forward, we had to make some bets. So we said, hey, what do we think will happen? And other industries had to make these bets as well. So, you look at banking and they're like, okay, we're going to have an increase in digital usage. We thought about it the same way. We said, surely we need to accelerate our investments in digital because the members will be coming to those channels. The banking industry saw it. We didn't. And what happened was the members went in and they said, okay, I want to talk to people on the phone. Or I still want to mail in paper. And so even though we accelerated investments, we didn't get the uptick on usage that we expected. I think overall, the industry responded really well in terms of sort of reacting to this new hybrid remote structure. And it impacted not only our members who needed the servicing and still preferred other channels, it also impacted our associates and it impacted our patients. And so from a patient standpoint, telehealth was there, so our physicians could utilize it, but it wasn't there at scale. And so we saw a huge uptick, and we anticipated that and moved forward, so that was a good bet. From an associate standpoint, we had no idea when the pandemic started that the perception of where engineers wanted to work would change dramatically. So they were all in the office, and now all of a sudden they were all at home, kind of liked being at home. And then they realized they were actually working more because you didn't have that break in transition. And then as the times went on to now we're hearing stories like, hey, they're running side hustles. They're not actually being as productive as they were before. So we're still evolving into where we need to land. And so a lot of companies, including ours, are thinking about, should we have some in office, some out of office, so you get the collaboration that you need? How do you keep people challenged when they're sitting at home? You can't just throw extra work on them. They've got to be have skin in the game for some of those things. And so, I would say we're not finished evolving yet since post-pandemic. And we just need to keep our eye on what we think healthcare will morph into. Like, my vision of the future is when I need Medicare, let's use that example, that I can go into a primary care clinic, never get a bill, know exactly how much it's going to cost before I go, pay my bill, never hear from them again on that particular service. But we have a long way to get there because of the systems and the interoperability between those systems. And so we're focused on how do we get there, as well as planning for, should the ecosystem shift again, are we going to be ready for it next time?
That's great, Katie. Mangesh, I know you've got kind of an interesting experience because you're kind of on the health system side. How have you seen things in kind of your area of the health ecosystem? And I know you've got a little bit of a background that is a little bit fresh from the perspective that you don't come organically from healthcare. So a little bit about you maybe to kick us off and then some thoughts.
Yeah, and that would also work as a caveat for me. So I joined HCA about 8 months ago. So my experience in healthcare is that long, and not just HCA, but healthcare. But I've been in overall, prior to that, I worked for about 10 years at Disney, worked on equally large, complex, operation-heavy organization, but also delivering experience at the same time. And there's a lot of parallels I could see. So right around the time of COVID, I was at my prior employer, and maybe I could speak to some of those experiences as well. But
that'd be great.
I think some of, I had in fact, great deal of education from my colleagues at HCA, hearing from their experiences and inspirations on, how the healthcare was pressure tested overall. And it just kind of shook things up in a way that some of the, on the provider side at least, or they reacted in unprecedented way how the teams came together, and there were stories of heroics. Now, what happened after that is, once they had time to, reflect upon it, they're like, gosh, how did we do that? And there was something good. I mean, it was all exhilarating. It was all like we were on steroids, but why can't we just continue to do that? And one of the things that occurred to them is, actually, we can do these things. We don't need an exogenous trigger for us to do that. So one of the things at HCA that was born out of it is our innovation group. So we have a dedicated group now for care transformation and innovation. I'm one of the members of that group as the Chief Analytics Officer at HCA. So it's heavily sort of data, AI driven, but also really thinking forward and intentionally very lean. It's a cross-functional organization. It was just like how the pods were assembled as a Tiger team response. And we just decided organizationally to continue that momentum and convert that into a best practice in the industry. So that was more from the organizational response, and I think I look forward to sort of that happen at scale across the industry. Looking back at my time at Disney around COVID, there were a lot of learnings on actually just the whole uplift of the technology stack. So I spent a lot of time, last my 20 plus years in technology, and the adoption of digital in general, it was a lot more, especially if you're a brick and mortar business, the digital was seen as something that's a convenience. That's okay, well, you're using it front of the funnel, maybe a little bit in the marketing, but especially digital experiences as a companion to the physical world. That was established during COVID, and I sometimes even joked about, that's the chief digital officer that we were missing all along. I'll just give an example. I think we used to run some of the highest quick service restaurants or fast food within the sort of theme park setting. It's very high throughput, extremely dynamic, plugged in environment. And up until COVID, I think if you look at, we had a convenience feature for people to, order your sort of meal over phone. And there was about 7% adoption prior to COVID. Now, because of social distancing and other norms, that jumped to 80%. Just 7% to 80%, right, as we went back. And, normally you would have a lot of, say, initiatives that were below the line. Oh, that's just convenience. When it gets prioritized, it's these things might end up below the line. But one of the things we realized that suddenly now your user base shifts to that big volume. While you're serving your customers really well, the data that you get in exchange, like if you know how your customers or whoever you're serving, how they're planning ahead of time, and if you have access to that data, you can be a lot smarter about operations in general. So that is what you as a business got in exchange. And I just think that everyone learned that okay, you have to offer something to get that very rich data in return that then you can apply to running your operations.
Yeah, and historically in healthcare, we don't think of data as currency, right? Yeah. It's not built into the mental model because of the kinds of data that we engage with and the respect that we have to treat it with. But as you've said, that there are opportunities to really decrease the friction, increase the experience of the patient. And that's actually a really interesting segue, because Frank, your business, it did get quite substantively changed. Like in many ways, you were in some ways disintermediated in terms of some of the mechanisms that you were delivering out to your clients. And when we were talking in prep for this panel, you were talked about some of the ways that how you fundamentally changed how you think about the circle of care. And I'd love to hear how you guys responded at SureScripts.
Sure, glad to. And just a little of my background, I've been 40 years in healthcare, and I describe myself as a small-town pharmacist because I started out 40 years ago in a little town called Lynchburg, Virginia, as a community pharmacist, and went on from there through life sciences and a number of other. And I've been the last 18 months at SureScripts, and I think most of you probably know SureScripts, but just a little background. And actually, one of our founders, John Driscoll, is here in the audience, and he's one that helped put this all together. But in the last year, 22 billion transactions across the healthcare system. Only 2.3 billion of those are actually e-prescriptions. The rest are the movement of clinical data to empower physicians and pharmacists and nurse practitioners across the ecosystem to be able to clinically practice. During the pandemic, and I've only been CEO for 18 months now, but I've been able to witness a transformation that's taken place in the company. Immediately went remote. We had to keep the systems up and running. We've got 99.69 uptime on our systems, and the backbone of really e-prescribing in the U.S. depends on SureScripts and what we do. The team was tremendous in moving to sort of remote management. I think we learned some lessons during that. We did a great job. We also knew we had to make sure that the clinical data, as pharmacists started to provide immunizations and other things, we had to make sure that clinical data got back into the EHR. And so with our clinical direct messaging, it allowed pharmacists to message back into the EHR, which hadn't happened in the past. And also, I think what happened was the U.S. started to recognize the role how important that pharmacists play, and seeing pharmacists as more than just providers of, I'm going to count to 100 by fives and I'm going to give you your prescription, but really the importance that they are to the healthcare system. And what the gaps that they filled during the pandemic and now are continuing to fill with either test to treat or immunizations or the many other things they can do. So as we look to the future from what we saw established during the pandemic, we're concerned about a number of things, to be quite honest with you. We see this silver tsunami that's coming that's creating a real desert, healthcare desert in a lot of places where there aren't enough physicians or primary care providers to step into that gap. And when you look across the rest of the healthcare providers, the area that there's actually enough resources and that want to practice at the top of their license are pharmacy. But we also see things that are happening today, like Walgreens going out on strike and some of the CVS stores going out on strike. The pandemic, the burnout that it caused among healthcare, either the practitioners and the pharmacists, because they weren't organized correctly, weren't operating as an overall healthcare team. I think we're going to continue to see that transformation over the coming months and coming years, with pharmacists taking more on that lower level, I would say the beginning areas of primary care, physicians, as there's fewer and fewer of those to treat the patients, to working more as a team. And we have to, as a technology company, make sure that the technology is in place to empower pharmacists with the right clinical data, right clinical information to be able to provide that first level of primary care. Now, there are a couple other things that have to take place as well. First of all, reimbursement structures have to be put in place. Pharmacists can't just ignore filling scripts and go over to the primary care sort of role that they'll be playing. So we need to make sure the reimbursement structure is in place, both private as well as public. And secondly, the state laws need to recognize, and it's a state law based what pharmacists are allowed to do in their practice, need to recognize the scope of a pharmacist's training and empower them to do these other things. So a lot of learnings from the pandemic we're taking into the future as we see this evolution of the healthcare team that's really needed.
Yeah, and actually that leads into kind of my next question, which is, looking forward, one of the points you made, which is like operating at the top of your license, and the fact that there are these healthcare deserts. As we look forward, the second and third order consequences of the past few years, the burnout, the change in the nature of work, the change in the demographic of the workers and their expectations, and the technology tools they need to kind of support that, and how data enables us as leaders to create that environment so that we can operate successfully for all of our stakeholders. Mangesh, maybe you can talk a little bit about how you have a very large workforce nationally. You touch all parts of this, from primary care all the way through to acute, not ambulatory, like whatever it is, you're in it all.
Yeah.
Can you speak to how your organization's thinking about the next few years in front of us, and how we kind of handle some of these wake effects of the decisions we've made over the past few?
Yeah, and that's also a very important topic, because overall the projection is that there's going to be a shortage of care providers, pretty significant shortage, and there are we already have some strategic levers we have pulled all the way from the pipeline and training that is feeding into that, but still I think we need to do more. And there are two areas that we think if we do them well, we will be able to meet that demand. So the first one is embrace AI in a way that can augment or enhance that shortage. And I think that's the pitch that healthcare has, as compared to, say, some of the other industries, is what I like. That if you get really thoughtful and methodical about a competency level analysis of what skills we need to fill a gap, and then look at AI to be able to then fill in those blanks, but still have the decision control with the humans. So this is going to require a bit of education and training ahead of the curve. I mean, I know some of the medical programs that have already started educating a multidisciplinary combined medical and AI programs. The same thing, I think, need to expand to the technicians or the nursing staff as well. So that's one part, and that's kind of how, all the way from the ahead of the curve, we're looking at it. Even from the generational perspective, I think sometimes, one of these exogenous factors is this generation shift that happen. And if you look at, so my daughter is 14, and I sometimes imagine, 5 to 10 years from now, she's going to be in a workforce, and she's a Gen Z. It's very different. All the way from, sometimes I need a translator to hear. But there are changes in how these Gen Z is going to be your nurses and care providers of the future, and we need to create an environment that is welcoming, that is accommodating of them, which does involve kind of looking a bit deeper into. I mean, a lot of times companies do that with their customers. They're especially very consumer-centric companies. They have a deep segmentation and sort of understanding of the customers and the payers and the potential customers. And I think some level of that thoughtfulness need to be applied to your employees as well. Same thing, I think, the concept that we applied to, say, the concept of guest in Disney, even in the care to the patient, some level of that needs to be applied, because again, they are going to be the patrons of the patients that you will be serving over time. A big part of that goes through the digital channel. So you have to invest in those digital channels that are not just episodic or dealing with them one episode at a time and seem very transactional at the moment. That you check in and you check out and you're done. Next time you're a completely new person. I think a lot of that focus from a demographic perspective is shifting into a level of always-on engagement. So if you're in a care provider, and if you really care about the wellness and the improvement of human life in general, then you got to be able to make investments that connect in between and become a lifestyle coach or become a health advisor, now that you have an understanding of what their health profile looks like. And I think those type of engagement models through digital channel that are a lot more self-service, does not have a lot of friction involved, having to set up appointments or having to call someone, I think is probably going to make a huge difference with the generation change.
Hey, Mangesh, I would also add, I think the other component of that is not making assumptions. And I think what we're finding with members in insurance is, it's kind of like early days of banking. Like, if we build it, they will come. Self-service, pricing effective channels, things like that. And everybody goes to Gen X is more digitally savvy, so of course they're going to sign up for Medicare Advantage through a digital channel. But when you talk to people, and I liken it to myself, like if I want to invest in a startup stock, I go out and I do a bunch of research, and I'm like, hey, if I want to make a material investment, like, I want somebody to tell me I've made the right choice, because it's high risk. You'll lose your money, right? Healthcare is high risk. So when you talk to the seniors, number one, it's really complicated. And number two, I want somebody to tell me I made a good choice. And I'm going to tell them, these are the things I need. This is what I want to pay. And I want them to say, yes, you made a good choice, and this will take care of you, and you're not putting your health at risk. And so there's two components to this, which is, from a physician's standpoint, we can make their work more efficient. So we can have a nurse in a home, and we can say, okay, you're going to use text-to-speech. Technology tools can solve some of those efficiency things. But when you're talking about selecting your health care insurance from a payer, it's a different kind of view of the world that says you can't just go make self-service and assume people will come. Yeah. If you understand why they're not coming, you can go address the root cause. And so it's a complex sort of ecosystem that we're navigating as we go. But we always have to remember, at the end of it, it's a human. And you've got to have human-centered design, and you've got to really go after the root cause, not just build things and assume that your consumers will get there.
Yeah.
If I could just, back on the prescriber clinician standpoint, I think we have, for a number of years, and John Scully made a comment a number of years ago at a conference where he said by 2025, healthcare will be less expensive than it is today. That was back in 2018, because technology is going to solve this, is going to be the solution. And I think because healthcare is broken in so many places, what you saw crop up were all these little point solutions, to deal with every little thing. And what the technology did was really overwhelm the clinician, because it takes more time to deal with each of those. So technology is one of the answers. I think what we have to do is make sure we're utilizing the technology, applying it appropriately, so the workflow of the physician or pharmacist or any of the healthcare providers is such that they don't spend most of their time looking at the computer screen, and they spend most of their time looking at the patient and helping the patient. So I think what we're realizing now is we have to really evolve our view of technology and how it's applying to the market, and the advantage of it, and how it should be appropriately applied to help streamline and take some of that administrative burden out of the mix.
Yeah, it's not an end, right?
Right.
It needs to be the part of the means, right, not the means. And yeah, I think that's a phenomenal point. And as we look forward, or your organizations are going to be dealing with these things, which you can plan for. And then there's going to be things that you can't plan for. Yeah. And that's something that I think we've all, definitely in my professional career, I did not have something like the pandemic. We had scares, but nothing to the level of the last few years.
You're still in your professional career, Bob.
Thank you. That's good. I hope my boss heard that. So how do we, as leaders who are now going to be kind of steering the ship as we move forward over the next, let's say, decade, maybe a little bit more than that for me, how are you guys thinking about it? How can we be better prepared? How can technology as a tool, and then maybe speak a little bit about what's on everybody's mind, Gen AI or other forms of AI. How does that play in as our workforce changes? We have now AI workers in the mix. How are you guys thinking about it? Maybe Frank, you could start.
Yeah, glad to. And I'll say I think SureScripts did a remarkable job responding to the pandemic, how we empowered clinicians with the right information at the right time. But I think we also recognize, and the company recognized some things. Right now, we host our own data centers, and so we need to be able to scale very quickly. So one of the things we're doing is in our process of moving to the cloud. And I think some of my folks in the audience, they'll know I'm saying we're not moving quick enough to the cloud, but we're on our sort of a 3-year journey to get to the cloud. The other thing is we've always done all of our development internally, right? We've got the best developers, I think, in healthcare across, maybe the country. But we haven't relied on other things that help us scale more rapidly, like our new partnership with Emids that we're developing.
Thanks. I didn't pay him to say that.
Yeah, he didn't. But again, I think that will make us able to scale much more rapidly to be able to respond to some of the things we need to. While we responded wonderfully, who knows what the next sort of black swan event will be? I mean, what is it we're going to be responding to? The pandemic, we did have a few months in there. We started to look at it. There are things that may happen overnight that we need to be able to respond to. And so I think just becoming more resilient, more able to deal with some of those things in the future is going to be a key.
Yeah. Mangesh, what about you? And how is HCA thinking about this on the front lines?
But only if I could predict the next black swan event.
Yeah, exactly.
Would probably change my career. But I think even though we don't know precisely, I think there are a couple of factors that are going to be useful no matter what. And especially, I think, in a company like HCA, given the scale, I think our ability to centralize and decentralize quickly, because we rely a lot on standardization, but also at the same time, we rely a lot on the autonomy. And depending on sort of the context, I think we are able to zoom in and zoom out very quickly. And I think developing that muscle and keeping that trained, because it takes time to train that sort of organizational muscle. So I think that's one important part. The other piece, I think, from a technology perspective. So there are some foundational technologies that are important. So, for example, sometimes you have, like I lead a team of data scientists, and no matter how smart people you hire, but if your engine basically cannot do more than developing reports and dashboards, then you're wasting that talent pool or the bandwidth. So whenever we're talking about a technology transformation, I think sometimes these decisions happen top down. And in that process, there is a blind spot that you may lose your sight to the actual value creation. You may just say, hey, we are here on-prem and we are going into the cloud, and the easiest path there is to do a lift and shift. But then you basically collect some of your technical debt and then amplify that in the cloud, because that's not suitable to now run in the cloud. So you're not really getting that benefit. So my advice there is, whenever you're doing that, always have a roadmap that creates incremental value. Like, start small. If you don't necessarily have to do a lift and shift, you may have the opportunity to redesign your data strategy as you're, say, making that change. But also actually execute and apply some use cases right on top of that small first piece that you're going to move, and see validate your hypothesis. Are you actually creating value out of that? And then sort of build on top of that. So be open to that continuous learning. I think that's something, with this CT&I, Care Transformation and Innovation initiative, we're being very intentional about value creation in our technology journey. So that could be useful to everyone else.
The other thing you asked us to address generative AI and how we're using it. I remember when AI started to become a thing, I talked to Mark Ingridge, our CIO, and he said, well, we've been using AI since the beginning of SureScripts. And I'm not a technologist, so I had to have that explained to me, right? So we have, since day one inside of SureScripts, been using machine learning, large language data set models. But generative AI is a different story, right? And so we currently have a number of our data scientists looking at it. We're going to be incorporating it in some ways in the future, but I'll say we're taking a cautious approach because still of some of the unknowns there.
Yeah.
We know that it's great for taking a 300-page medical record, boiling it down to that summary of data that's needed for a pharmacist to make a clinical decision or engage from a clinical standpoint. But some of the answers you get back aren't always what you expect, or maybe always documented in the literature. So we're being very cautious how we move there. But again, we do believe it's going to have a massive impact as we move forward in the future.
Awesome. Katie?
So, our organization is a payer, and we're in home health, and we're in primary care, and we have CenterWell clinics. And so I think the really important thing that we've been focused on is not underestimating the value of integration and modernizing the platforms that we've had for a long time. And for many years, business segments within our organization would build for the segment because it was the fastest way to get things done. And it was the way we got to the segment of the membership that we needed to get to, or to home health, or whatever the case may be. And, we've taken a step back and we've said, if you really do want to end up with an integrated healthcare experience, you need integrated systems. And so we're actually starting to unpack things. So lots of folks run claims on mainframe systems. We're one, it's 40 years old, right? So you look at it and you say, how do you start peeling back the onion and pulling things out of the underbelly of the mainframe? And as we do that, how do you actually build integrated services by using microservices effectively, by moving data to the cloud, creating modules of services, to Nagesh's point, to get there faster and make it more flexible? And while we're not having a black swan event right now is the time to focus on those things, because, our patients, members, associates, want to work in the way they want to work where they are. And so you've got to tend to the channels, you've got to tend to the human behind it, and you have to have systems integrated in a way that will support the full cycle of things for our members, patients, associates, et cetera.
It's awesome. It's great. I had asked the panel to do 3 questions, but I see we have 5 minutes left. So very, very, precise and focused panel. Awesome. So I'm going to do a little bit of a lightning round. You guys up for it?
Sure.
All right. So
Depends on the topic.
It'll be, don't worry, it'll be safe. So as you guys think through and as we kick off, kind of this summit typically forms a data point in the planning process of many of the folks in the audience as a way to both connect with fellow leaders, but also as a mechanism for kind of understanding how other parts of the ecosystem that they may not directly interact with, how they're thinking about their next 12 to 24 months. If you were to speak to one of your customers, then you can pick and say, hey, like from a foundational perspective in your business, to make you easier to do business with, what would you say in a minute and a half? Maybe a much longer conversation. I guess
What would we tell our customer they need to do for us to get?
Yeah. To be easier, so you could be easier to do business with them. So either it's a change you could make in your own organization or a change in their organization. The essence of the Emids Summit is about we bring people together who maybe were not able to have that high candor conversation. A little bit of a provocative thought.
For me, it comes back to the patient. And I would tell them to, all in healthcare are mission-driven in some ways. So for me, it's let's do the right things that are going to help the patient at the end of the day, right? We have processes inside of SureScripts that are way slower than they should be. So speed is something that I've talked to our folks about. It's something we're focused on and going to do better with. Those of you that historically know SureScripts, we haven't been known as the most nimble, quick-to-react company. That is changing. We're not your daddy's SureScripts. So for me, though, it always comes back to, are we going to do things that improve the quality of care, improve patient safety, or lower the cost of care? And I would ask our customers and SureScript Network Alliance partners to do the same. And if we both focus on those things around the patient, hey, we'll move much further, much faster than we would otherwise.
It's awesome. Mangesh, Katie, popcorn style, whatever you...
Maybe I could take next. I'll take advantage of my position as an outsider from healthcare, where, we are representing the payer, provider, and pharmacy, I think, say, different parts of that ecosystem you talked about. And, many of the folks in this ecosystem have been there for a long time. Now, one of the problems with that, we just talk among ourselves a lot. We leave the other people out, the patients and the family. And so this complex system has, actually, when you see it from outside, it's just a lot of times doesn't make sense. Our patients and and their family members, they don't see our department structures and who does what. They have a problem, they need to go to somebody to solve it. And when the challenge when we talk among ourselves, we end up building organically a lot of what I would call as inefficient processes, just one on top of each other, like just among ourselves, that really this person over here has no idea what we're doing. And just make it complex. And now what we're all rushing to do with the advent of AI is to automate it. And when you automate a bad process, it becomes worse, right? So now what's going to happen is on each of our side, we're going to look at generative AI. Oh, that whatever you're sending it to the payer, automate it, have AI build it for you. Somebody on the other side, I'm going to review it. I'm going to use AI to review it, respond it back. And now you have 2 bots talking to each other at some point. This might happen. Like everyone's kind of in their own silo, own pocket, going to use AI. And it will reach some sort of equilibrium or, imagine like an arbitrage that would happen over time. Now, the good part of that is we all as an industry will come to the realization that there are certain unnecessary steps that we're trying to automate that were not needed in the first place. They just have evolved, and I think it will trigger some sort of reflection going outside of our boundaries, and I'm really, I think, very optimistic about that impact of AI on the industry.
Awesome. Katie, you want to take us home?
I know we're down to the last minute. Since we have a bunch of constituents, I would just say focus on simplicity, transparency, and care, basically. So, our patient should be demanding care when and how they need it, whether that be through a digital channel or in person with a physician. Our associates should be focused on building simplicity so it's easier for our members to understand what they're getting when they enroll. And our providers should focus on, integration mechanisms that make it easier, as well as focusing on value-based care, because the studies will show you all day long, you'll reduce hospitalizations if you have value-based care. It's good for the provider, it's good for the patient, it's good for the payer, actually, at the end of the day. And I think that is what actually is going to drive us forward. If everyone demands what they need where they need it, things will change.
Yeah, and that in some ways is the most foundational of steps, right? So thank you very much. I want to thank my panel. It's an excellent conversation. I hope you all in the audience enjoyed it and got something out of it, and thank you again.